Our global health correspondent Tulip Mazumdar reports on the events that led to more than 1 million infections.
A milestone that nobody wanted to reach. It's believed the outbreak started here at a wholesale seafood market in Wuhan in China at the end of last year. By early January, the country confirmed it had identified a new coronavirus, and cases there started to soar. It didn't take long for COVID-19, as it was later named, to then spread all around the world. It took more than 2 months from the first reported case in China for the number of infections to reach 100,000. Then, just 2 weeks later, cases doubled to 200,000. Now, in the last week alone, the number of infections have jumped from 500,000 last Friday to more than 1 million now. And here's how it all unfolded. Cases in China were rising rapidly in the first couple of months of this year. South Korea was next to see a sharp rise. But by the middle of March, the global picture changed. Italy was hit hard, along with Iran and then Spain, and then a huge rise in cases in the US. All these countries were ramping up their testing at these times too.
So 1 million is obviously a huge number and presents an important milestone. But I think what we need to remember is that these are the number of diagnosed cases. And in fact, the unknown of the amount of people that haven't had a test to know they've been infected is obviously likely to be much greater than that. So my worry really is what this means globally, and we're keeping an eye on many other countries around the world, especially, for example, Africa, where some of the case numbers are really beginning to creep up.
We've seen what happens when this virus hits countries with relatively strong health systems. In Europe and the US, medics have been overwhelmed. There are grave concerns about what will happen in countries with far weaker healthcare facilities. South Africa currently has the largest outbreak on the continent, with more than 1,400 known cases. Smaller outbreaks are also underway in countries including Burkina Faso, Cameroon and Senegal. Elsewhere, there is some very early, very cautious optimism. China says it has largely stopped the spread of the disease there, with parts of Wuhan now reopening. South Korea has also seen cases fall in the last couple of weeks. But it's still extremely unclear how this pandemic will play out as cases globally continue to rise. Tulip Mazumdar, BBC News.